Good morning and welcome to the teleconferencing session for students of Diploma in Nursing Administration. This being your first teleconferencing session for the year 2007, I am sure you have received your material. I know from Delhi, 2 students have not received the material, and if you can tell your enrollment number, we'll be able to see that the material gets dispatched to you. So that's very important that you have first the material with you. During the induction meeting, I remember 2 students pointing out and you forgot to give us the enrollment number. But all of you must have received this program guide. And from this program guide, just read it and check whether all the blocks which are mentioned in this program guide you have received or not. Because the number of blocks, the number of study material in practical which you are supposed to receive are detailed out in this program guide. Otherwise also, go through the program guide for your theory counseling and practical contact session so that you are prepared how many theory hours you will have from your academic counselor, what we call it as face-to-face counseling, and how much time you need to spend on the practical contact session. At the moment, we have 4 centers, so I hope the students are sitting in Ludhiana, Delhi and Pune and I feel the Kashmir, Jammu and Kashmir. I remember Madam Hasina coming last time with all her students, and I wish to see and listen to her when the students are over there. May I request the regional directors to kindly give us the attendance of the students, whether they are from the old batch of students or new batch of students. Kindly facilitate them to attend the teleconference and ask us the questions. So with this, I would like to introduce you to our experts. On my immediate right, we have Ms. Elia Makora. She is nursing superintendent at St. Stephen Hospital. She is also program in charge for Diploma in Nursing Administration for Delhi region. Next to Ms. Kora, we have Mrs. Syriac. Mrs. Syriac is one of the senior teacher in School of Nursing at Stephen Hospital, and she is a principal of Stephen School of Nursing. Mrs. Syriac has been contributing a lot towards the development of various activities for the schools of nursing. We are very pleased to have both of you with us, and I'm sure the students are going to have a lot of benefit from you. With this, I just want to remind you that for your course on Diploma in Nursing Administration, there are 4 courses. Today we will be concentrating in the first hour, that is from 12 to 12:40 on block 1. We will have a break of 5 minutes, and then from 12:40 to 1:30 we will be concentrating on block 3. You can ask any question from block 1 when we are going to have discussion on block 1, and then after a 5 minutes break you will have a discussion on block 2 and you can ask any question. For the students who are registered in 2006, you have a question from your program in charges whether you will have exam in June or not. You are going to have the term and examination in the month of June. The date sheet which is put up on the website is tentative. You do not find the Diploma in Nursing Administration appearing on that date sheet, but you will be getting that very soon. So that is just to give you a reminder that you will have an examination. The first batch of students who got enrolled in 2006 would have their examination in June 2007. But those of you who are enrolled in 2007 January, it's not a semester system, it is an annual system. You will have examination in the month of December. You'll ask why the other group is getting 1.5 years and you are getting 1 year. Because we started the counseling and contact session for the students enrolled in 2006 much later, and for you we are starting at the right time. That's the reason. Well, any other administrative question if you want to ask, you are most welcome to interrupt and ask us. Our producer will roll down the telephone number of the studio as well as fax number, so you can interact with us through the fax or through the telephone, which is a toll-free call. And you can also, our regional directors would facilitate you in interacting with us. Well, with this, I won't come in between the experts and you because you would have a lot of questions to ask. So we start with block 1. Block 1 has got, if you have the block with you, block 1 has got basically 4 units, and in the 4 units we are having concept, philosophy, purpose and scope of nursing and public administration. elements and principles of nursing administration, theories of organization, and role of and responsibilities of nurse managers. So with this, let us start with what is administration, what is management. Ms. Kaura, would you like to describe these terms, please?
Administration, when we say, that is the direction, coordination and control of many people who are working for the achievement of same purpose. And administration, when we, as a leader or as an administrator, when you say, that is, you are seeing that things are getting done with the accomplishment of that specific or definite objectives.
So, as you can read, Ms. Kaura has got a good slide. It mentions, can we have the slide back, is the direction, coordination, control of many persons to achieve the same purpose or objectives. It is also getting the things done with the accomplishment of defined objectives. Would you like to elaborate with example, please?
When a nursing administrator is wanting to achieve the best quality of care in a unit, she is developing certain objectives, then she is writing down the objectives, she is having the direction, she has to direct that specific unit people, then she has to coordinate the entire work of that unit, and then she controls the entire unit function. She sees that enough people are there to carry out the program, and then she sees that things are on the move so that that specific objective is achieved with the best quality.
I think that's a good example. Ms. Sirek, would you like to add any other example for the administration, please? Yes. For example, I thought if we are saying that the staffing pattern in a particular ward we want to improve, that is the objective, because as Ms. Kaura mentioned that the quality of care has to be given to the patients. So if we want to improve the staffing pattern in the ward and that is an objective, then the nurse administrator starts. Yes, please, Shillong. Yes, Shillong, we are online.
Hello.
Yes.
Hello.
Yes.
We are speaking from IGNOU Regional Center, Shillong.
Okay.
We are to inform you that we have 8 participants here.
Very good.
And secondly, we would like to inform you that 2 of our students are yet to receive their study materials.
Could you?
I'd like to give their enrollment numbers kindly.
Please.
070 62 8430. Second one is 07062 8448.
8448.
These 2 students, they have not received the study materials.
Okay.
The others, they have already received.
Good.
And secondly, some of the students who have received their study materials, they have received the assignment questions of the 2006. We would like to clarify whether the assignment for 2007 is the same as 2006 or not. Thank you.
Okay. Thank you so much for calling. Well, it's welcome to the teleconference, all the 8 students who are sitting over there. And the assignments, we'll check it up how it has gone wrong, and we will dispatch it because it's a small number, so we'll be able to dispatch the assignments again. And the 2 students who have not got the study material, I'll follow it up and find out from the MPDD division that why you are not able to get the material. Good. So you can ask the questions also, and thank you Shillong for calling us from the regional center. So we were talking about the administration. So one of the objectives will be to have the staffing, and for to meet that staffing need, probably the nurse manager or nurse administrator will sit down and work out where there is more staff from where she could withdraw and provide the quality care, not affecting the care to the ward from where she withdraws. Yes, what is management then, Ms. Kaura?
Management is the process of decision making and control over the action of specific group of people to express purpose of attaining the predetermined goals. In management, when we say, for the same example of quality care, if we are taking the decision of having a specific number of people in a specific unit for achieving the goal, you are giving them the specific role, what they have to complete in that area, and seeing that that is done.
How do we differentiate administration from management?
In administration, we are planning the whole thing, and then say for example in the intensive care unit, if you are wanting to have the best possible care, you need to have 1:1 ratio. But when you are posting the people in the intensive care unit and you are seeing that the number of patients are less in that unit and there are some other areas where more patients are, you remove the people from intensive care unit and place them only for that particular day in the other area, so that other areas work can go on smoothly, and then you are able to control the work in that particular area for achieving the goal.
I think this is very important, and very nicely it is given in your print material also that administration is an enabling process. It is an enabling process because it helps you for achieving the lay down objectives which are there of an organization, and also formulating the plans and policies which can be administered. But when we talk about the management, it is a process of carrying on those activities so that you are able to provide the quality care which Ms. Kaura very rightly mentioned. So administration is enabling process, whereas the management puts that process into action. Like she was saying, that you withdraw the people from giving a quality care, and the objective is achieved by seeing that the implementation of the plan has been done. Am I correct, Ms. Kaur?
Yes.
So these are some of the examples, and for purpose of understanding, most of the time, if I am not mistaken, you can correct me, the administration and management is used interchangeably.
Yes.
Yes? Okay. Because it's because it is inbuilt, that is why it is changed. It is used interchangeably. Well, some of the fears which our students would have is, what is the philosophy of nursing service? How do we explain about the philosophy of nursing service? Ms. Kaura, you were dwelling on it. Let's know what is philosophy.
Philosophy includes many factors. One is interrelatedness. That is, you need to see the quantity, quality, the cost, work, and the available resources. Many a times we don't see the relatedness of available resources with the quality of service what we give, and the quantity of materials what we need, and the time what we are utilizing, the effect of the work what we are wanting to have, whether we are getting it or not. That is one factor. Second is the factual evidence. That is, we need to avoid the resources wastage, and the decision of various variables are also depending upon this. The third point in philosophy, we can say that it is delegating the responsibility. In our routine day-to-day work, we say assigning the patients. Assigning the patients is one way of delegating the responsibility. Then the fourth point is individual and organizational goal. That is, the individual need to manage people, and the good morale of staff for achieving the goal successfully is important. Effective communication. Communication is needed among all the staff. What a ward sister conveys or communicates to her staff is invariably is what is going to lead them for that particular unit's management. It is vertical communication and lateral communication. But at the same time, we need to have certain amount of flexibility. Flexibility, when we say, that means if we are having a rule that we should not be having people coming very late, but at the same time, suppose there is a bump and people are not able to reach in time. They may be coming 10 minutes late or 20 minutes late. But at the same time, we are seeing that enough people are there. So all these points together makes the philosophy of nursing service administration.
In other words, we also want to say that nursing service administration department believes When you write, there's a very good example given at the end of your unit, that how to write the philosophy, that is, nursing service department believes in providing quality care to the patients by effective communication, by providing staffing, manpower. So when you write philosophy, it's a belief of the nursing personnel, belief of the nursing service department, which are depicted in terms of philosophy. For example, if you say that you want to start an intensive care unit, so the belief of the nursing service department would be to provide one-to-one care to the patient. The belief will be to have the lesser stay of the patient in the ICU, less of the death rate in the ICU. So these are some of the beliefs on which the hospital and the individual works. Now, as Ms. Kora mentioned, that individual goals and organization goals, sometimes I feel, the individual goals are also geared towards the organizational goals. For example, if a nurse wants to have an experience in the operation theatre, but the organization cannot give her the experience, maybe she has to postpone for some time. But that chief nursing officer or nursing superintendent keeps in mind that such a goal this particular nurse has, and we should encourage that when we can post her for that kind of particular clinical experience. So organizational goals are more important and individual goals are achieved through the organizational goals. I think that's very good way of explaining, and it is given in your content area also. Is there any question? We have got 2 students sitting in studio also. Is there any question from Shillong? Because I know in Shillong the people are sitting. I haven't heard from Jammu Kashmir, and I'm sure you are there. Please get connected to us and ask any question if you have. Let's quickly go to what are the objectives of nursing service department. Mr. Syria, could you like to say what are some of the objectives of nursing service department, please?
Yes, based on the philosophy laid by the Nursing Service Administration, it is for the clarity, the objectives may be classified under the 5 headings given. That means objectives for the delivery of client care, and establishment of physical environment, and establishment of concept or environment, and achievement of individual objective, and contributory of individual objective. So these are the objectives of nursing service department, which is to be maintained for.
Would you like to elaborate any of the objectives, Ms. Kura?
Yes, the client care. Invariably, all the hospitals' nursing service department is aiming at the best client care. When we say the client care, it includes carrying out all the measures, that is, right from training a student to becoming as a staff, and then taking up the responsibility step by step. That is, she may have to have the therapeutic measures carrying out, she may have to make specific studies which may be developing the quality care and effective utilization of personnel available in her department, and to formulate recommending policies for improving the care of patients in that specific department, because the needs of the patient varies from unit to unit. The need of a patient in the intensive care unit is different from the need of a patient in the intermediate care or step-down ICU, and there the need is different from the need of a patient in a general ward. But at the same time, we need to see that supporting and promoting the hospital policies and regulation is also important, and planning. If an administrator is there, she is expected to participate in planning the total needs of the total patient and planning in the on-the-whole management of the institution. When we say we are developing the standards, we need to see that the care is up to the standard, and then we need to see that the professional status is also maintained.
I think this explains why it is important to have the objectives. But if you have seen, the objectives are emerged from the philosophy. I heard Ms. Kora talking about these aspects when she was talking about the philosophy. That means what is believed by the hospital, by the nursing service department, those beliefs are also translated into objectives. And these objectives are achieved by providing care to the patients, by organizing certain staff, manpower planning. All these things are interrelated. So just get an idea that what you believe as a nursing superintendent of a hospital, you and your nursing department believes in providing quality care to the client, to the patients. And how do you provide that quality care is reflected in objectives. And that's what is very important for us or for you as nursing student to know. So philosophy should be clear. They say if you have formulated the objectives clearly, 50% you are clear what you are going to achieve, or 60% you are clear what you are going to achieve. Do you have any question on this Unit 1? Because I think Ms. Kora and Mrs. Syriac very clearly mentioned what is administration, how do you differentiate from the management, what is the philosophy of nursing service administration, and what are the objectives, by giving 1 or 2 examples. If you have any question to ask, we can answer. Any question, anybody? Not from the studio. Anybody else sitting on all the other regional centers? And I am happy if Shillong has any question, kindly facilitate them to ask. The students, if they have any question, kindly help them to ask a question. So you can interrupt and ask us in between. We'll go to our next unit, and the next unit, as you know, talks about the elements and principles of nursing administration. Nursing administration, as mentioned by Ms. Kora, to begin with, is to administer. It is an enabling process in which the nursing personnel carry on the activities to provide quality and effective care to the patient or to the consumer. Now, it's important that we know what are some of the elements or function of a nurse administrator. Mrs. Syriac, would you like to tell us
the
some of
elements
the
of
functions?
administration who may be having? First, we had to have a planning of that one, and we had to organize it. And while organizing, we should see that the staffing pattern also, and we had to see the directing things, and then we had to see the what coordinating things, what is there, and another we should know the reporting, and we should have a budget for that, achieving that functions, the elements of functions of administration. So these are the points. First we had to see that. Every things before doing that, we should have the complete planning, and we had to organize it, and then after that the staffing pattern we had to see it, and after that we had to giving the direction for different means we are contributing the work to different peoples, and you had to see whether the coordination is there or not, and after that we had to see that how the reporting is. It's very important in the nursing service process of the reporting is also very important, and then we had to see whether it is the budgeting is there or not. So these are the points which you had to be kept in mind.
Ms. Kora, would you like to explain what is to be included in the planning or these factors which Mrs. Syriac has mentioned?
Planning, when we say to start a unit, we need to plan the manpower, material and money. When we say manpower, we include for starting a unit how many nursing personnel are needed. Then we calculate, other than the nursing personnel, how many helpers, how many IRs, how many auxiliary staff are needed. That is manpower planning. Material, for that particular unit, what are the things what you need, starting from equipments, starting from the routine stationery supplies, everything what we need to list down. Then it's a part of budget when we say money what is to be spent for running that particular unit. So that includes planning. But when we are saying planning, a good planning will be having, it's again a flexible plan, but it should be done in a simple way, and it should not be creating any complexities, and it should be communicated to the members who are involved in that particular team.
Now, how do you differentiate strategic planning from the operational planning?
When we say strategic planning, it is developing the broad objectives. whereas in the operational planning, it is the lower organizational level usually.
In strategic planning also, for example, the policy decisions are
Yes.
to be made, policies are to be changed, the building is to be brought up, or we need to recruit more manpower, so calculation. So it may be 2 to 3 years to 5 to 6 years planning. But as you very rightly said, the operational planning will be right. For example, in a particular ward, you want to change the system. Maybe you want to make it on a progressive patient care. You want to shift the beds of the intensive care next to the unit and intermediary care and then convalescent. So that can be done within the ward.
No,
So that would be more of a operational planning. And the steps, what are some of the steps of planning we keep in mind?
Analyzing the situation of the particular area. That is, when we say analyzing the situation, if we are, the simple example, if you are having a 30-bedded unit and if your number of staff is less, that means the patient care will be, the quality of care will be very poor, and based on that, when you are analyzing, if you are taking the feedback from the patients who are coming to that unit, you will be able to know whether that particular unit is having enough staff or not. That is example for analyzing the situation. Second is identifying the priority problem. If you are having enough people to work, if you are having enough material to handle the particular situation, then you will be able to give priority. If a patient is going into arrest, that patient needs immediate care. Whereas if a patient to be shifted from one area to other, if both the things are to be done at the same time, in priority basis, we will be attending to the patient who is going into arrest. And formulating the objectives. Whenever we are planning for a unit or for a day's work, we need to plan our work. And when we are planning, we need to set the objectives, because our work will be for achieving that
Khanna,
particular
excuse me.
objective.
Can I interrupt you? Yes, Khanna? Yes, please. Yes, please, Khanna? Hello? Okay, maybe you can ask us in between. Probably we got disconnected. You are talking about the objectives,
Yes.
formulation of objectives.
Formulation of objective is important because our work is always aiming towards achieving the objectives and goals. And many a times we do have the limitations. If you are wanting to do something, but maybe due to lack of manpower, maybe due to lack of...
Yes, Khanna? Yes, please.
Hello.
Yes.
Good afternoon, madam.
Good afternoon.
Madam, calling from Regional Center Khanna.
Yes.
We have around 5 students here with us.
Okay.
This is for confirmation only. Thank you.
Okay. Thank you so much. If they have any question, kindly facilitate them to ask the questions. Okay. So you were talking about formulation of objectives.
objectives and goals to be formulated,
Mhm.
and then everywhere, no matter in which unit it is, there could be certain limitations, and limitations could be of the manpower limitations or material limitations, and usually we don't face the money limitation in the clinical area, and that comes only when we are asking for a certain material or manpower in the budgeting. When we are planning our day-to-day routine, we don't face that particular limitation. And once we are planning the thing, then we need to have the operational policy system. We do the nursing care planning when we are students, but when we cross that limit, we don't do the nursing care plan. But planning day-to-day work is important. For every administrator, it is important. I'm going to take care of this many patients. I'm going to have class for this many staff. I'm going to address my group today for this many hours. All those things have to be in our plan.
I quite agree with you that the nursing process or nursing planning is not done, but I'm sure the mental planning is done, and if we have adequate staff, they do prioritize that these patients, as you said, if the patient has come with arrest, they would attend to that particular patient first and then to the other patients. But yes, planning in the form of process is very important, because that also helps you to monitor whether the care given to the patient is effective or not. And I quite stand by you that we in the nursing profession continue what we learn, so that you are able to assess the patient, evaluate the care at the end of the day what the patient has received. Well, that's about planning. How about the second element which Mrs. Siriak mentioned to us is organizing. What do we mean by organizing? Can we have the slide, please? Yes.
When we say organizing is actually we are giving some shape to the plan. We plan for doing the things, but for achieving that particular plan or achieving that objective, we need to have certain things to be on the move. So when we are planning to have the things and when we start working towards that, achieving the objectives of that plan, that particular thing we call as organizing. That is maybe putting some of a fixed person or a certain amount of people in an area, collecting certain amount of material for carrying out that particular task. All that comes in the organizing process. And organizing, many a times, it's group activities. For achieving the objective in a hospital, it's always group activities. It is interdepartmental and intra-departmental activities. Many a times, we do see that it is covering up the line and staff authority, the functional authority, hierarchy authority, delegation of authority, and the span of management.
Yes, I think a bit of it, if you can explain them, because you see, line and staff authority is little sometimes confused to understand. So if you can explain what is line and staff authority?
Line and staff authority is a single person cannot achieve what we want to. If we are saying that we want to achieve the best care for our patient A. Now, patient A may be having a lot of problems. Doctors come and order certain things. But you feel that your unit is not able to have that particular type of care for the patient. You may have to get extra hands. What do? You inform your supervisors. Supervisors provide enough people if she can. Suppose the supervisor is not able to, then what the supervisors do? They go to the next level. They inform the ANS or the DNS. And then if they cannot solve the problem, they go to the higher authorities. And this is the line of authority. From the nursing superintendent to the deputy, to the ANS, to the ward sisters or to the supervisors, and then to the ward sisters, then to the staff nurses. That is the line of authority. But at the same time, every individual nurse who is working in the unit is having certain amount of right or authority to carry out certain things. When they are in difficulty, we stand by them to help them out. And many a times, people don't understand that we are there to support them. We are there to handle the difficult situations along with them. And when we say the line of authority, many a times we think that if a director or the medical superintendent is wanting to convey a message, he or she is not directly conveying the message to a staff nurse. Instead, message is given to a nursing superintendent, then it goes down to the staff nurse, from nursing superintendent to deputy ANS, and the same way, if a staff is wanting to convey a message to the director, again, the reverse manner, the same message is conveyed. Staff nurse to ward sister, ward sisters to the higher levels.
What Ms. Kora is explaining is hierarchy and authority, more of it. To add up to line and staff, what Ms. Kora was trying to explain is that each of the nursing personnel, there is an advisory staff and there is a functional staff, okay? Ms. Kora and me or Ms. Syriac, when we are working in the clinical area, we become a line kind of authority in which we are competent in our field. And as Ms. Kora was trying to mention, that we need an advisory person also in decision making, because there may be certain things which we are not aware of, but there are advisory staff who are aware of it. They are the policy maker, decision makers. So they become our advisory staff. Likewise, a staff nurse who is a technical person to a clerical staff who is actually advisory for the administrative rules, but now the staff nurse may become advisory staff to him or her when he asks about the health related things. So Ms. Kora was trying to tell you about the line and staff arrangement and hierarchy and authority. Hierarchy, she clearly mentioned to you that how it goes from one person to another. In line and staff, of course, the line functionaries are those functionaries which do the work for that particular objective. The nursing people do the work for nursing care services, whereas the administrative staff does the work to support for carrying on the effective nursing care services. So the administrative staff, Ms. Kora and Mrs. Syriac put up a requisition that I require for my ward 4 more beds. There is a space, I can put 4 more beds. So the administrative staff advises that as per the norms of our hospital, you cannot put 4 more beds because the distance to be maintained is this much as per the hospital rules, or as per the legal rules, whatever it is, you can have 2 beds more. So that means that administrative staff becomes the advisory staff or staff authority to explain us what is legal. And then similarly, suppose the patients are not getting care or patients require more care, the line authority, functional authority, like the staff nurse, ward sister, they will tell to the administrative staff, these things are essential to carry on the procedures for the patient. So that means that is the advising capacity. Why I am saying this, that nursing people always not on the line authority also. They are at the advising side also. So they become the advisory staff, or there is the advisory role also, as well as a role of staff. Staff is advisory role, and line is actually doing the job or work for which you are prepared. Ms. Kora was also mentioning about hierarchy and authority and how important it is to work that in a hierarchical manner to achieve the objective, institutional objectives as well as personal objectives. But she also mentioned that there has to be responsibility with the authority, that we need to have that kind of responsibility when the authority is given. We cannot have the authority and not accountable and not be responsible of patient care. You ask Ms. Kora today, she has left the hospital and come, but how many people she has delegated the responsibility before coming for 2 hours over here? Because you have the responsibility, you are accountable for the nursing services, and you have to be answerable if the patient is not getting the proper care. And she or he cannot leave the place without making such kind of arrangements. Am I correct?
Yes.
So this becomes authority and responsibility. So these are some of the organizing functions of nursing administrator. We go to the next function, which you talked about principles. What is the next function which you would like to talk about? Staffing? Would you like to?
Staffing, many of the people will be knowing.
Okay, but let's, which principle you think you would like to elaborate on? Because staffing also, it depends upon various factors.
Can talk about staffing.
Okay, you would like to talk about staffing. What about the staffing as a function, and what is the role of a nurse administrator?
Staffing, when we say, it includes the whole personal function of bringing the manpower as per the need of the particular area. As I told you earlier, the staffing in an ICU is different from staffing in a medical ward because the need of the patient is also varying. When we are doing the staffing, we often do the staffing based on the need of the patient, that is totally ambulant patient, the partially bedridden patient, the bedridden patient but not helpless, partially helpless and totally helpless. Now in a place like ICU you will be seeing totally helpless patient, but you will be seeing the patients who are totally ambulant in a medical ward. So in other words, we can say that the number of staff needed in an area high dependency unit will be more than the number of patients who are needed in a less dependency or an area where the ambulatory patients are available or patients are staying. And many a times, depending on the care needed, for that the sister or the person who is assigning or allocating the staff need to do a small study. They need to assess the needs of the patients who are coming to that particular area. They need to assess the time, nursing time required to carry out certain procedures in that particular area, and they need to have the relationship between these two factors. And along with that, when we are assessing the kind of patients coming in the area, we will be able to see the number of staff we are needing in a specific area.
Okay, so I think that's very important, that what factors should be kept in mind while doing the staffing of the ward. What is the other principle you would like to explain to the students, please?
Directing.
Okay. Directing is another important principle because the care nursing administrator has to direct, as Mrs. Siriak mentioned, that when we have planned, when we have organized the activities, we need to direct appropriately so that the patients are able to get effective care. Yes.
In directing, the authority is given with the responsibility, and the staff or the group of people who are in that particular area is expected to carry out their responsibilities. Say for example, if you are giving 15 patients to one of the staff nurse, you may be giving her patients who are bedridden, patients who are totally ambulatory, and patients who are totally dependent, but they do not be needing the care as that of an ICU patient. What happens is, very often when we are delegating the responsibility, what we see is responsibility is given to the staff, but you are not seeing the needs of the patient. So delegating responsibility always should be depending upon the right job given to the group of people or to the right group of people. Then communication is the second important thing when we are giving the responsibilities or delegating the responsibilities. What is expected from them and what they can do, where to go or whom to approach if they are in need. And many a times we forget that they are also people who are to be listened. Many a times we expect them to listen to the patients, but we forget that we also, we the administrators, need to listen to the staff nurses. So along with this, we need to have in-service training so that we can make sure that our staff nurses are up to date. That is, every day new things are coming up in the medical field. New things are diagnosed, new equipments are coming, new needs of the patients are also varying. And many a times we don't update our nursing personnel. Many a times we forget to send them for the in-service education or to organize in-service education programs for them. Motivation is the next part, and motivation we need to have many a times.
Okay, so I think, sorry, you have just stopped in between only. You were talking about the motivation, and motivation, as you said, we need to have constant motivation for providing effective nursing care and also updating our knowledge and skills. Well, as the time is up, we need to close over here for this session, and we will have 2 more units of this block left, which we may cover up some other time, but we are not getting any questions. Either you are understanding everything or you are concentrating on something else, because experts are trying to explain you everything very minutely. So if you have any question to ask, you can ask us. We will have a 5 minutes break and we'll go to block 3 now, so that you can have certain, covering up in block 3, and then in the next teleconferencing session, we'll definitely complete block 1 and also block 3, so that your 2 blocks are completed, unless you want something else to be discussed. So let's break for 5 minutes and come back for resuming the same session, and we will have the experts discussing about block 3. Thank you.